So the single best thing you can do to prevent back pain is learn how to pick things up properly. Because I've been a chiropractor now for 24 years. And I would say the thing I see most is people that throw out their backs, picking up a baby or a bag of dog food or a rock in the backyard or whatever, a pair of shoes. And it comes from bad movement habits in terms of picking things up. So I'm going to start by picking this thing up the wrong way. So this is just the foam roller. So what she's doing here is rounding her back, and that's bad. This is where the trouble starts right here. What we want to do is keep a slight arch in that back. So go ahead and stand up tall. Make that little arch in your back, and then come forward. So she's coming forward at the hips. We're exaggerating this a little bit as a stiff-legged deadlift. You wouldn't really pick up with your legs together like that. But the point is the arch in the back. So this is called the hip hinge. So go ahead and stand up again. So when we're doing it in real life, we're going to separate our feet a little bit around the object that we're going to pick up. We're going to keep a little arch in the back, and we're going to come down. And then lift that object back up. Okay, so this is a foam roller that weighs nothing. So we're going to replace that with a 26-pound kettlebell. So you see that? Keep that arch and pick it up. So to transition this from a hip hinge into more of a deadlift, we're just going to add a little more knee bend. So we're going to first do that by separating your feet a bit. Okay, and so then you're going to start with that hinge, a little bit of knee bend, pick the object up, come all the way up. So if she were to do this, this is a 26-pounder, if she were to do this with a rounded back, she would be putting herself at risk of hurting her back. And this is where the trouble starts. It's that bag of dog food. It's the baby in the car seat. You know, you have the weight of both of those together. And when you're picking that up with your back rounded, you're begging for trouble. So again, it starts with the hip hinge. So the best way to learn this is to go ahead and pick the kettlebell up. So let's pretend she just was standing there with a kettlebell. And you're just going to hinge at the hips and let the kettlebell go to the ground and keep that arch in there. You'll feel those muscles working, especially if you're not used to doing this, and then come back up. So again, transitioning into a deadlift, it's the same thing with a little bit of a knee bend. So you don't need to load a barbell up with 400 pounds to do the deadlift. You can take an ordinary small dumbbell, small kettlebell, and get used to this motion. But when you learn to do this properly and habitually with everything that you're picking up, you're ensuring that your back is less likely to blow out and need someone like me to come fix it. Okay, so let's talk about something else. Let's say you need to move an object from point A to point B. So let's put this thing down. So let's pretend this is a bag of dog food. I'm going to have you step out of the way for a second. And so we have the dog food next to wherever you store the dog food, and you need to put the dog food away. So what you want to avoid is flexion and rotation with the load. So we want to work on moving an object from point A to point B without rotating. So what you're going to want to do in this situation is bend down, get the object, take a step, keep that arch, and then put it where it needs to go. Okay? So pretend you're scooping at your bag of dog food, you're keeping your arch. So take a step out to the left, and then plop it in there. So you can even stay down without coming up. So let's start over there. So pick it up, stay low, put it away. So it's that pivot step. It's transferring a load from one point to the other without rotating your spine. Okay? So you just want to squat down, deadlift down, pick it up, go ahead and go the other way. Step out with the leg, put the dog food in the pantry. So to review, hip hinge, add some knee bend, keep that back arch, use a step if you have to transfer a load. Stay safe, stay strong, and we'll see you next video.